Hi everyone, my name is Stephanie Stout. I chose to take children and families at risk because I've done a lot of work with children and families at risk. I've worked in residential care for 3 years as a direct care floor staff. I've done a lot of the ins and outs of working with the children who have had some really terrible pasts and histories with trauma, um, as well as I interned with DSS and foster care, and we did some family therapy and some reunification stuff, and just seeing all the different dynamics of the family, which was actually really big for me because I struggle with some of that, which I'll get to with that part with abuse. And then I also currently intern in a residential where I'm a clinician, and it's a different side of direct care, which I'm very used to. So I like the more clinical side rather than the very direct care side because it's a step back and it gives you more time to do the therapy and the working through of the things rather than just going through the raw emotions with the kids, which as a direct care staff you do a lot of. So that's why I chose this because it's really major to me. It's something I do every single day. As far as what I hope to learn, so because of everything that I've seen and I've experienced a lot of kids who come in with extreme abuse and neglect, and I see the physical and the psychological damage that it does, I struggle sometimes with the parents. I've always had a very protective things of my kids because a lot of their aggression and their terrible behaviors are from the things that have happened to them and their defense mechanisms, and the fact that some of these parents could do that to their children and or let other people do that to their children without standing up for it, has always kind of been a really rough thing for me. So as that's part of my issues with abuse, which is like one of the questions that we were asked, but also it's something that I hope to learn is more about how an entire family can be at risk and maybe how to do some prevention and to understand a little bit more about, certain parents' dynamics and the way that they handle situations in their families and their households. Even if it's not in the best interest for their child, some of it I do understand is for survival and techniques and things like that. But at the end of the day, I'm very prone to protecting the children that I work with. So, in terms of abuse, things that are sensitive to me, I'm going to be honest, I've seen a lot of things and experienced a lot of things firsthand. So, it takes kind of a lot to get me rattled. With actual abuse and trauma. But when it comes to the parents, I'm not usually the best when they're in the room because I get kind of frustrated and kind of upset to hear them tell about like all the bad behaviors that their kids have and all the things they experience when a lot of it comes from some deep rooted serious trauma. But I also know that many of their family members have undergone trauma too, and that it is a big cycle. So we see that a lot with the families I work with. So I guess that's my biggest thing is the sensitiveness with reunification and constantly trying to push home visits on kids and getting them to go back to an environment that necessarily wasn't safe at one point, and expecting the children to thrive in these environments. And so that's a little bit about me. I'm really looking forward to this class and maybe learning some new skills that I can use when working with families and children, and maybe to help prevent some of the terrible things that I've seen. So I hope everyone is excited as I am. Thanks.